Hi, everyone. Today, we're talking about a condition you might not have heard of, Piriformis Syndrome. Actress Andie MacDowell recently revealed she was diagnosed with it, and it's got a lot of people wondering, what exactly is it? Let's break it down and make it easy to understand. Piriformis syndrome is a condition that happens when a tiny muscle in your butt, called the piriformis muscle, irritates or pinches the sciatic nerve. The sciatic nerve is the largest nerve in your body and runs from your lower back all the way down your legs. When this nerve gets compressed, it causes some pretty uncomfortable symptoms. People with piriformis syndrome often feel pain or a deep ache in their buttocks, and it can even spread down the back of the leg. Here's the tricky part. It can feel a lot like sciatica or a herniated disc, which is why it's sometimes hard to diagnose. Pain or numbness in the butt and back of the leg. Tingling that feels like pins and needles. Trouble sitting for too long, walking, or even climbing stairs. Pain that gets worse with hip movements, like twisting or crossing your legs. So what causes it? Well, there are a few reasons, like overworking the piriformis muscle, which happens a lot in runners or people who exercise heavily. Sitting for long periods, especially on hard surfaces or with bad posture. Trauma or injury to the hip or buttock area. Muscle spasms, or inflammation. And here's an interesting fact. About 25% of people have a sciatic nerve that goes right through the piriformis muscle instead of around it. If that's you, you're more likely to experience this condition. This part is fascinating. Diagnosing piriformis syndrome isn't always straightforward because its symptoms can mimic other conditions. But here's how doctors figure it out. They'll start by asking about your symptoms. When the pain happens, what makes it worse, and what helps. They'll press on your buttocks to check for tenderness or tightness. Then there are specific tests like the FAIR test. This involves bending your leg at certain angles to see if it stretches or irritates the muscle. The seated piriformis test. They'll have you cross one leg over the other and lean forward to feel a stretch. The Freiberg sign. This involves rotating your hip to pinpoint the pain. They might use imaging like MRIs or ultrasounds to rule out other issues like a herniated disc. Fun fact, diagnosis often comes down to what's called a diagnosis of exclusion. That means doctors have to rule out all other possible causes of sciatic nerve pain before confirming it's piriformis syndrome. The good news? Piriformis syndrome is treatable. Most people don't need surgery. Here are some common treatments that work. Stretching and physical therapy to relax the muscle and improve flexibility. Taking breaks if you sit for long periods, standing and stretching really helps. Ice and heat therapy to calm inflammation and reduce pain. For severe cases, doctors may recommend injections like steroids or Botox to relax the muscle. And there you have it. Piriformis syndrome might sound complicated, but with the right diagnosis and treatment, it's something you can manage and recover from. Oh, and before we go, here's a surprising tip. Sitting on a thick wallet in your back pocket can actually trigger this condition. So maybe think twice about where you keep it. Thanks for watching. Don't forget to like, share, and subscribe for more health tips.
See you next time.